Sean, you're a health system specialist with UNICEF. Could you tell me a little bit about, what you do and exactly why you do it? What's your mission?
So UNICEF does a lot of work in global health. Key areas that we focus on include maternal health, child health, reproductive health. We do a lot of work with HIV/AIDS, nutrition, and increasingly UNICEF is engaging more heavily, more strongly in the health system strengthening area. This includes supporting national government policies and strategies. In many countries where we work in Africa, for example, the governments have not yet articulated a vision for where they see technology, where they see health information. So UNICEF, being a UN body, works often very closely with the World Health Organization to help put in place that enabling framework, that enabling environment to allow many of these exciting mHealth interventions that we've been hearing about today succeed. Along with the policy level, we do a lot of work coordinating partners, coordinating donors, and ensuring that funds, that programs are not duplicating each other and that money is well invested. And the third area that we're doing a lot of work in right now is on the scale-up of successful pilots. We have a number of programs in, for example, Uganda that have reached national scale. There's a program called mTrack and DHIS2, two open source tools that target strengthening of the Ministry of Health's HMIS system, the Health Management Information System, the aggregate data in the country. We've been working with them over the last 2 years to bring this to national level. Currently we have DHIS2 rolled out in every single district. We have mTrack, a mobile app for reporting this HMIS data, rolled out via 26,000 health workers and close to 4,000 facilities. So we work on a range of different levels.
Okay. Now, obviously, many countries in Africa, a lot of places don't have running water or electricity, but a lot of those people will have mobile phones. So, what have your participation numbers been thus far, and why mobile health? Is that why it's kind of an easy to reach those people? Or?
So UNICEF sees mobiles as a huge opportunity to not only expand the services that we offer, but offer them in a completely new way. In Uganda, for example, the mobile phone ownership rates are over 40% now. Health workers, teachers, literally everybody at that level that I've worked with owns a mobile phone. They might not have access to running water, they might not have access to a toilet, a flush toilet, but they likely have access to a mobile phone. And so we've seen this as, as I said, a new way not only expanding the reach of our services, but for example, we are supporting the Ministry of Health with a program called UReport. UReport is a community engagement tool where citizens can report service delivery problems. They can, we have regular dialogue with them around key development issues, livelihoods, access to health services, school, and in ways that we have not been able to do previously. We've engaged huge numbers of people. We have 250,000 people on the UReport system in Uganda. We have every member of parliament participating. And so we're seeing dialogue happening in ways that was not possible a few years ago. Citizens directly participating in the development of their country, letting government, letting UNICEF, letting other international partners know what they care about, where they want to see investments, and what's working and not working. Which is changing the way that our programming is being run and how we react to changes on the ground.
So you're now seeing that dialogue, and you said you've seen considerable progress thus far. What do you hope things will look like, 10 years down the road? What are the big things you're looking for?
So one of the big changes that we're seeing is that data is not being used as a post facto audit of what went wrong. We're actually getting data in real enough time to make changes during the rollout of government programs, while people are actually being affected by these issues. A good example of this, a few months ago, the World Health Organization, UNICEF, the Ministry of Health introduced a new vaccine. Now, there was a gap in knowledge on how ready health facilities, districts would be to receive and administer this vaccine. What we were able to do with the tools that we had through DHS2, through MTRAC, through U-Report, is run flash surveys, polls. With our database of 26,000 users, very simply, we asked them a question. At your health facility, is the cold chain fridge, which is used to store the vaccines, is it functional? And if not, tell us about it. Within 24 hours, we had data from close to 70% of the health centers in the entire country. Total cost of this exercise was about $150 US. And most excitingly for me, and this is where I think the focus is going to be shifting to, is on data utilization. We were able to work with the Uganda National Expanded Program for Immunization, identify areas, districts, health centers that were not able to receive the vaccines, and follow up before the vaccines were introduced. One of the things that we had come out of these surveys was that 13% of the facilities in Uganda had fixable, solvable issues that were preventing their ability to provide vaccines. These included lack of gas cylinders to power the fridges, minor mechanical problems. This affected 4 million Ugandans. And again, before this vaccine was rolled out, Ministry of Health was able to go out and address these issues. So we're very excited to see this new relationship with information, with reporting from community members on what issues they feel most deeply about, and use this to directly influence our programming policy, not in 3 years, not in 5 years, but today.
Well, it's very exciting stuff, Sean, so thank you so much for speaking with me about it.